So hello there. My name is Nunez, and I'm going to be your student doctor today. Can I ask you to confirm your name and date of birth?
Yeah, my name is Grace Yustin, and I was born on January 23rd of 2000.
All right, perfect. So, what is your ethnicity, Grace?
I'm Caucasian.
All right. So, what brings you in to see me today?
I've been experiencing blurry vision.
All right, blurry vision. And this blurry vision, is it in both of your eyes or one of your eyes?
Yeah, it's been both my eyes.
Both. Okay. And how long ago did you start noticing this blurry vision?
It started about a year ago.
1 year ago. And for this blurry vision, is it uh, always occurring, or is it worse in the evening, worse in the morning?
Yeah, it's definitely worse like in dim lighting. But yeah, like it's mainly like when I'm like looking at my phone or doing something up close, like reading a book or looking at my screen really close at work.
Okay. So how severe would you say this blurry vision is? Does it obscure your day-to-day workflow or anything like that?
I mean, it's definitely irritating, but it's just blurry. Like I can still kind of make out stuff if I'm looking um in the right way, if that makes sense, but it's
Okay.
not completely debilitating.
And do you use anything to help relieve your blurry vision? Do you squint or anything?
No, not really. Nothing's really been helping. And I don't have like glasses or anything to help either.
So the blurry vision, you said you notice it when it's like you're looking on screens and stuff. Is it
Yeah.
up close and at a distance, or at yeah?
I mean, it's kind of constant, but it's mainly like when it's close up, like looking at my phone type thing, but it's generally kind of blurry.
All right. And besides this blurry vision, is there any other issues that you're experiencing with your vision today?
Yeah, I've been having itchy eyes.
Itchy eyes. Okay.
Mm-hmm.
And this itchiness, is it in one of your eyes or both of your eyes?
It's in both my eyes.
Both. Okay.
Mm-hmm.
So, how long ago did you start noticing this itchiness in your eyes?
Um,
Or does it occur because of something?
I mean, it's been like kind of on occasion. I've noticed it within the past couple years. It's especially worse after I garden.
After you garden, you said?
Correct.
After gardening. And how often would you say you garden?
I mean, as much as I can. It's one of my hobbies that I like to do. So I'm in there a couple times a week.
And does anything you do make it better or make it worse?
I mean, like if I'm like rubbing in my eyes or whatever, it definitely makes it worse, but nothing seems to help.
So you said you're experiencing blurry vision, but it's more up close, correct?
Yeah.
All right. Do you have any burning or itching or tearing? You said yes because of the gardening, correct? Could be
Yeah, just
related.
for the itchiness.
All right. Do you experience any pain?
No, no pain.
No pain. Any flashes or floaters in your vision? You see these little specks in your vision?
No,
Any headache?
no.
And lastly, do you experience any double vision?
No.
So now that we're done with that, I'm going to move on to your ocular history.
Mhm.
So do you remember the date of your last eye exam?
Yeah, it was 2 years ago.
2 years ago. Do you remember the name of your optometrist or ophthalmologist?
Yeah, it was Dr. Almir.
Dr. Amir? Do you currently wear any glasses or contacts,
No.
or in the past at all?
No.
No. All right. And do you have any past ocular conditions like
Um,
glaucoma, cataract,
no. No.
and any ocular traumas?
No, nothing's happened.
Okay. Now I'm going to move on to your medical history. So do you remember the date of your last medical exam?
It was like 6 months ago.
6 months ago?
Yeah.
All right. And do you remember the name of your doctor?
Yeah, it was Dr. Sandra.
Dr. Sandra.
Mm-hmm.
And do you have any medical conditions, past or current?
Yeah, hypercholesteremia,
All
not hypo. My bad.
right. Hypercholesteremia. All good, all good.
Mm-hmm.
So when were you diagnosed?
That was like 3 years ago.
3 years ago. Okay. And do you follow up with Dr. Sandra for your hypercholesteremia?
Yeah, I see her every 6 months.
All right. Good to hear. Every 6 months. And is this currently stable?
Mm-hmm.
All right.
Yeah, I take Lipitor daily for it.
Lipitor. Okay.
Mm-hmm.
How many milligrams of Lipitor are you taking once daily?
10 milligrams.
10 milligrams. Okay. And how long ago did you start using Lipitor? Was it 3 years ago when you first got diagnosed?
Yeah.
All right. Do you take other systemic medications?
No, I don't.
And do you take any medications for your eyes at all?
No.
No? All right. So now that we're done with that, I'm going to ask you, are you allergic to anything?
Yeah, I'm allergic to penicillin and I get seasonal allergies.
All right. So you say you have seasonal allergies. That's making me think that maybe there's a correlation with the gardening and your itchy eyes. So we can look more to that. For your allergy to penicillin, how severe is your reaction?
I mean, it's manageable. I get hives.
Hi. And how about for your seasonal allergies? I'm assuming the itchy eyes are correlated, but do you know anything else that may come from your seasonal allergies?
Yeah, I just get like congested.
Congestion, all right?
Mm.
And do you use anything to treat yourself when you have a reaction to either penicillin or seasonal allergies?
No.
Okay, all good. Now I'm going to move on to your family ocular history. So, does your family have any eye conditions like macular degeneration, glaucoma, cataract?
Yeah, my grandma has age-related macular degeneration.
Uh, your grandma, is she on your mother or father's side?
She's on my mom's side.
Right. And is she currently seeking treatment?
Yeah, she gets injections in her eyes for it.
So she's getting treated, and I'm assuming, is she stable right now?
Yeah.
Stable? All right, good to
Mm-hmm.
hear. And besides your grandmother, is there anyone else that has eye conditions in your family?
No.
Okay. So for your family medical history, does your family have any medical conditions like diabetes or anything like that?
Yeah, my father has diabetes and hypercholesteremia.
Got you. All right, diabetes. And hypercholesteremia, you said?
Mm-hmm.
All right. So is your father currently seeking treatment for either his diabetes or hypercholesteremia?
I don't know. I don't talk to him.
All good.
Yeah.
So besides your father, anyone else in your family that has any medical conditions?
No.
None? Okay. So next, I'm going to move on to your drug history. Have you ever used any tobacco products? Do you currently use tobacco
No.
products? None? All right.
No, never.
Do you consume any alcohol or in the presence of any alcohol?
I have the occasional glass of wine, like once a week-ish.
You said once a week, correct?
Yeah, about that.
Okay. And do you consume any recreational drugs?
No. No, I don't.
Okay. And any coffee?
No.
So now I'm just going to ask you, Grace, what is your occupation?
Oh, I'm a fourth grade teacher.
That's nice to hear. And what do you like to do for your hobbies? You said gardening, correct?
Yeah, I like to
I
garden
remember
and
you
cook.
mentioning that. Gardening and cooking.
Good
Oh, I
memory.
like doing that too. Yeah.
It's fun.
All right. So now that we're done with that, is there anything else you would like to address before we move on to your vision screening?
No.
All right, perfect. And that'll be all. Thank you so much.
Thank you.